Welcome to Vet Luminous. Today we have an interesting case. So this case is a female dog of breed miniature Pomeranian weighing 3.5 kilos. This dog is suffering from a condition called as stone in the urinary bladder or also called as urolithiasis. As you can notice here, this is the X-ray of the patient which was subjected to radiograph examination. As you can notice, there are multiple radio opaque stone-like structure near the bladder area. So by taking an X-ray, we are able to diagnose this particular condition as a urinary caliculi. As you can notice here, these are the big caliculi noticed over here. So this is the area, and this is on the other view. You can see very clearly the radio opaque caliculi. Normally urinary caliculi are common in case of male dogs or in male cats, but here it's in a female dog having a very large stones. As you all know, in female dogs the occurrence of the caliculi are not that common, owing to the breed predisposing, owing to the gender predisposing, the conditions are very less. Whereas in this patient, you can see a very large calculus can be noticed. So as and then the surgery goes on, we'll be giving you the further informations. Thank you. Mid-ventral laparotomy first to approach the urinary bladder. So as you have noticed already in the radiograph that there are many radio opaque caliculi present inside the bladder. So we are approaching this particular case by performing the mid-ventral laparotomy. Then we'll be approaching the bladder. Then we shall do the cystotomy for that. Okay. The linea alba. I'm incising the linea alba. Now I'll be extending the incision so as to approach the abdominal cavity. So here the laparotomy procedure is completed. Now our major goal is to the urinary bladder. Okay. So normally in the urinary bladder we have two areas, two surfaces. Actually it's a balloon like structure. We have two surfaces. This is the ventral portion and this is the dorsal portion. It's always advised to put an incision on the dorsal surface. So I'll be putting an incision on the bladder to perform the cystotomy and to retrieve all the caliculi. So there are too many caliculi in the bladder, so I'll be retrieving one by one. Okay. So before doing this, I'll be covering the whole of the laparotomy incision with a gauze so that there is no contamination. So it's always advised to put an incision on the area where there are less blood circulations or the less blood vessels. So now my preferred site is almost over here. I'll be putting a linear incision so as to approach this one. So laparotomy has been performed. Approach the whole of the bladder. So I'll be retrieving the stones one by one. So these are the very large stones are present inside. So this is the one of the stone, as you can notice over here. Okay. So like that many are there. the cystotomy by using a double layered inversion suture technique, that is Cushing's followed by Lambert's suturing pattern. Okay. Taking a bite on the normal portion of the bladder, I'll be starting with a simple surgeon's knot. Then I'll be putting a small hemostat so as to keep it secured. Now the first layer will be, the bites will be parallel to the incision. So the bite do not penetrate all the layers of the bladder, but only the partial layers of the bladder it penetrates. So one on the either side. So first I started on the left side of the dog, now I'm coming on the right side of the dog parallelly. Okay, so by doing this technique, by doing this bite technique, there will be inversion means the tissue rolls inside, so that will act as a leak proof mechanism. So here the first layer is done. So now similarly I'll be ending my bite over here and start the one more layer of suturing that will be perpendicular to the line of incision. So I shall end this particular over here on the healthy portion of the bladder. So I'll be putting a similar surgeon's knot over here also. First knot, and I'll be reinforcing it. That's it. So now I'll be putting the one more hemostat on this portion of the bladder. So a little bit of mopping. So now I'll start the next layer of inversion suturing using Lambert's suturing technique. So this will be perpendicular to the line of incision. So one bite over here. So we can continue the same bite to the other side also. So this will be perpendicular. Again, it is not a full thickness suturing. It's again a partial thickness suturing. So this is the first bite. This is second layer, second bite. So I'll be ending the suture along with this previous nail hole, previous suture bite. So cut the suture as close as possible. Okay, now I'll be placing the bladder back into position and I'll be closing the laparotomy incision. Okay, we have placed it back into position now. So now we'll be doing a small abdominal wash, then we'll be doing the laparotomy closure. So now I'm closing the laparotomy incision using a simple continuous suturing pattern. Okay, so while I'm doing this closing of laparotomy wound, I want to discuss with you regarding why does the dog or a cat have this urinary problem. Okay, so as you know, one of the major reason why the dogs have the urinary problem is the breed predisposing. Some of the breeds of dogs, they do have this breed predisposing issue with which we have this urinary caliculi are quite bound to happen. Especially in case of Dalmatian, we can notice a lot and lot of urinary bladder caliculi is quite common to be noticed. Okay. Second reason is the genetic predisposing. If the pedigree is having any issue regarding this particular urinary bladder or caliculi, so this has also been inherited through genetics also. And the third one and the one of the major reason why the dogs have this urinary problem is the food rich in protein. When you give a food which is very rich in protein, that is one of the major reason for this caliculi formation. And fourth is the water intake. When the water which you are giving has got more of hard water or more of salts are dissolved in it, that is also one of the predisposing for this particular condition. So how to take care of the dogs or cats having the urinary issue is the food. Manage the food, manage the water, and routine checkup will solve this particular issue. Okay, so here I'm. So normally it is said that the fascia has the highest suture holding capacity. Where the muscle doesn't have that much of suture holding capacity, it's always advised to take a bite on the fascia to have a good suture holding capacity. Make sure your knots and the bites are secure and are in good strength. Okay, so here I have almost completed, and now a last one more bite. So now I'll be continuing the same suture for the subcutaneous. Okay, so subcutaneous will be parallel to the line of incision and it's called as a walking suture. Okay, so just like a walking suture, I'll be putting an incision on the subcutaneous area. So now the subcutaneous suture has been over. So now we can use either the stapler or even the glue would be sufficient for this to close the skin incision, but I usually prefer a non-absorbable suture material to close this skin. Okay. So this depends on the surgeon whether they want to use a glue, stapler, anything is fine. But according to me, according to I feel more confident and I feel more secure when I use a non-absorbable suture on the skin. So here I am going with the mattress suturing, so to close the skin incision. Here I am putting a reinforced surgeon's knot. First knot should be very soft, not very hard. Second one mildly hard, and third one should be okay. Okay, this is how you put a reinforced surgeon's knot. For all the skin, I usually perform the reinforced surgeon's knot. I'll be putting a mattress suture now. So first I'll be taking a bite. Similarly, one more bite, and this will be the last bite. After this, what I will do is, you can notice very clearly here. So what I will do is, see 1, 2, 3, and a 4. 4 throws. I will be putting a first knot. Okay, second will be 3 knots. 1, 2, 3, then finally one knot, one throw. This is how I put my reinforced surgeon's knot. So this dog will be subjected for antibiotic therapy, change of food, and also medicines for the urinary antiseptics are to be given. So this dog should be